How's it going, guys? So this is Dr. Suh Specific Chiropractic, providing Gonstead Chiropractic in Manhattan, NYC. So we have a guest over here. As you can see, that's very serious and severe low back pain with a lot of sciatica going on, correct?
Yes.
All right, so understand that the sciatica, which is pain going down which leg, sir? Is it right or the left?
The left one.
Left one. And where does it stop?
The start from here in the back, go all the way my head and all the way down and my feet over here.
Where does it stop exactly in the left?
We stop over here, stop over here. Sometimes my feet pain over here.
So, but where does it usually stop?
Over here.
Around here?
Yeah.
Okay. All right, so that's usually a sacral nerve. So when you say sometimes it go down the foot, where does it stop? On the outside or inside?
No, inside.
Inside. Interesting. That's usually a fourth lumbar nerve involvement. Fourth or fifth lumbar nerve. Okay. So we got sacral and we got fifth and fourth potentials. All right, let's take a closer look, see what's going on.
Sure.
All right, so based on the history, okay, so we're already isolating, since he's talking about pain down to the Achilles region, that's a sacral nerve involvement. The fact that he says sometimes it also comes down to the big toe area. That's usually fourth and fifth lumbar nerve areas. So based on looking at the x-ray and then correlating with the history, then it says, okay, we got something going on over here. But the x-ray is pointing out, we'll touch base that in a moment. So he goes, no, this is not just a straightforward case. We've got other things complicating the area as well. And in addition to this instrumentation over here, this instrument, we're looking for any abnormal temperature. Because when the tissue gets compromised and damaged, it starts with that inflammatory process, which is telling the body, hey, go, guys, let's go check this area out. Let's see what's going on. See why the smoke alarms are going off in that area. And it introduces the white blood cells to the area by increasing the blood flow. And the side effect by having more blood into the area is you're going to have more higher temperature. And that's what this device here picks up. And we found 2 potential levels already. Now, we're not saying definitively says, oh, this is the exact same problem. No, this is like one check mark says, okay, we got to investigate these 2 areas closer. Clearly, there's some damaged tissue area. They're swelling, and that's what we have right over here. Okay, we got some pooling over here too. So now, how's this, sir?
No.
No pain. What about here? A little bit of pain. Here? Flinched? Yeah, pain right there. Okay, got a lot of swelling at this second sacral segment over here. Got quite a bit of swelling at this between 4 and 5. Even fifth lumbar is not that great either. Okay. Let's test this. Okay. Yeah, that's not movable whatsoever. I'm sorry about that. So the left hip, that's stuck. There's like a brick wall in there. The sacrum is not that great either. Right ilium is just fine. There's no swelling in there. But this one, a little swelling on the left-hand side. Okay.
Yeah.
See, that's stuck right there. That's not moving. How's that? How's that, sir? Pain?
Yeah.
Okay. What about this one? Not too bad?
No.
What about this one?
Yeah, pain.
A bit.
Yeah.
How about this one?
Yeah.
Pain, but not as bad as the first one.
The bottom.
So how's this one?
Yeah.
Some pain there, right? Some pain there too?
Yeah.
So which one's worse? This one or the bottom one?
Yeah, this one. Yeah.
Bottom.
My hip. Yeah.
Got it. Understood. And any of that duplicate the pain going on your leg?
Yeah.
Which one?
The one in the bottom.
The one on the bottom duplicate the pain down going on leg?
My hip, yeah.
What about this one? Did that go all down to your foot?
Yeah, in my hip. Yeah.
That too, right?
Yeah.
But does it go to your foot?
Yeah.
Yes?
The one, yeah.
Does this one go to your foot?
Yeah, this one, yeah.
Okay.
My hip on my foot, yeah.
Does it also go to the foot too or no?
No.
Okay, so fifth lumbar.
Yeah.
So now we confirmed it, duplicating his pain. Okay, so the 2S goes to the hip and to the ankle. This one goes to the foot. Okay, so now let's take a close look on this. So we have a DJD over here. It stands for degenerative joint disease. Okay, so basically this problem in there, the 2S, has been there for so long. Okay, this thing moved to compensate. To clarify what I mean by is this. Normal should have like this over here, okay? Now because your foundation is unstable, okay, Normal movement, it should be like this, lumbar spine like this, okay? What it should not be doing is the bottom part moving way too much like this.
Okay.
So if it moves too much like this, what's gonna happen is, it's gonna grind away.
Okay.
And that's what happened here. It just grinded all that disc away to almost nothing.
Okay.
Right? Now, we got some other problems going on. Is the fact that this fifth lumbar vertebrae, okay, as you can see over here, the nerve, it got to come out of this tunnel. And that's the one that's responsible for going on to your legs. Okay. However, in your case, it went this way and that way. Tunnel collapse, hit your nerve. In addition to, because the disc lost so much of the height, the tunnel collapsed even more so to the point that now we got this poor fellow right over here. There's not much of a tunnel in there and the nerve shriveled up.
Okay.
Just like a garden hose. You drove over the garden hose, you put your tire in the car on the hose itself. Yeah, the nerve, the garden hose is pinched off, right?
Okay. And
shrivels up. That's basically what we got over here. Okay, so we lost quite a bit of nerve function down to that ankle and the foot there.
Okay.
But in addition to, okay, what's complicating the matter is this. Once I set this, okay, it's gonna make this one even more backwards, meaning your symptoms, you're not gonna like the pain going out to your big toe. So to clarify to the viewers and the Gonstead docs, your spine's already like this.
Yeah.
So when I adjust your sacrum, okay, it's gonna go even more. The bottom sacrum is gonna go make it more forward.
Okay.
This one, in essence, it's like even more that way.
Okay.
So that's what I'm saying. You're really not gonna like it. So that's why normally I don't like to adjust on the same visit. However, we have no choice. We have after I adjust this one, I have to adjust your fifth lumbar immediately right afterwards to free up that big toe. Now, another thing, and this is the third whammy on top of all that, which I'm not going to adjust on today's visit. This is going to be a future visit. Your pelvis itself, you're tilted this way. And because you're tilted more like this way, the rest of your body is following along that direction as well. Okay? This is too high. As we found out, your left hip is too stuck. By adjusting the foundation, the sacrum over here, it's going to help calm it down a bit, but not enough. In the future visit, I need to address this AS ilium over here. All right. Okay. So when that happens, okay, what it does is it's going to reduce the height over here. As in other words, from here, it's going to steadily rebalance over here. Okay. But again, we can't just all three at the same time. We have to triage it, take what is the most urgent thing we need to take care of to visit right now, which is these two. Okay. I know. We're going to pump the fluid out first before we set it. Breathe. I know it's intense because there's a lot of swelling in there. I want you to just breathe. And when you're ready, come on up. Okay. Do you need your cane to walk?
I try to walk without cane.
Let's give it a try. Come back. So tell me, what's different?
Yeah, it's big difference, but still have a little bit pain over here.
I understand.
My hip, yeah.
And that's a problem from the fifth lumbar.
Yeah.
How's the ankle?
The ankle is no pain.
No pain.
No pain.
How's the pain to the big toe?
No, it's no pain.
Okay.
Only the pain in my hip, too much.
All right, we'll get to it.
Yeah.
Have a seat. Feel that? You just freed up the left hip quite a bit.
Yeah, hip too much.
Yeah, but it's still somewhat stuck, but we have to address that in the future visits.
Okay.
How you like that?
Yeah.
Not too bad, huh?
Yeah.
No, I understand. It's still swollen over there, so I need you to ice that up. Feel that? That's still in trouble. Yeah, it's still in trouble. You need to address that fifth lumbar. Good. Come on up. Open up. come back. Okay. Tell me, what's different in there now?
Before it was like the pain, like you can say like nine.
Mm-hmm.
Now pain like 4 or 5.
So basically,
Still,
50.
yeah, like 50%. Yeah.
50%
Yeah.
improvement.
Yeah.
Hey, that's a great start.
Yeah.
Okay.
Yeah.
So here's what I want you to do. I need you to ice your low back 20 minutes, 3 times a day. All right. Actually, no, I would increase it. I would do it every 2 hours.
Sure.
20 minutes every 2 hours. Calm it down.
In the middle? In the middle of my back?
Right here.
Oh.
This one I'm touching, right over there.
Sure.
It will contact both of these two areas, the second sacral segment and your 5th lumbar vertebrae. Calm it down. Make sure I also include, this joint over here as well, the left sacroiliac joint over here.
Sure.
Also, I'll calm down the left hip as well.
Okay.
All right.
Sure.
So we'll see you in your next visit.
Sure.
Right.
Sure. Thank you very much.
Oh, you're very welcome.
Thank you very much. Thank you.